A few weeks ago, I posted a poll on my Instagram story asking, does having good exercise technique matter? And while most people voted yes, there were some who voted the opposite. But the real question shouldn't be, does it matter, but rather, when does it matter? In today's video, we'll explore more about exercise technique and its influence on injury prevention, as well as maximizing performance in the gym. Exercise technique. Most people would argue that whether you're a competitive weightlifter or the average gym goer, having good exercise technique is important for preventing injury. And as a physical therapist, I'd be lying to say that I didn't spend most of my time correcting people's form. Having proper technique for both compound and accessory exercises is recommended, and as a general rule of thumb, you should familiarize yourself with an exercise before including it in your routine. However, once you have a good understanding of a specific movement pattern and begin to progress your intensity each week, small deviations in form are not only normal, but inevitable. Training goals will vary among Olympic lifters, competitive athletes, power lifters, and the recreational gym goer. But if your goal is to continually increase the amount or volume of weight that you lift each week, then I'll ask you one thing. Do the benefits outweigh the risks? This article in the Journal of Strength and Conditioning presents all of the benefits of weightlifting and reminds us that although injury certainly does occur in both weightlifting and weight training, injuries are uncommon. The authors go on to describe that typically, the injuries that occur in weightlifting appear to be the result of overuse, poor technique, or excessive collisions with the bar. But I think it's important to keep in mind that poor technique can be referring to an untrained individual performing a new exercise improperly, rather than a trained individual progressing his or her intensity with slight deviations in form. Now, although the risk of injuring yourself in the gym is rare, it can happen. And while overuse injuries tend to predominate these cases, improper form due to lack of knowledge or increased fatigue can certainly play a role. Let's look at the barbell squat as our example, as this is one of the most commonly prescribed exercises that is notorious for training errors. Some critiques you often hear with the back squat are push your knees out, chest up, back straight, go slow on the way down. Purposely ignoring these cues, or not making any attempt to perform the back squat correctly, can certainly place you at risk for both chronic and acute injuries. And as the research shows, there is merit in having proper technique to avoid shear forces at both the lumbar spine, hip, and knee joints. Speed of movement even seems to be a contributing factor when it comes to compressive forces through the knee. Untrained individuals, or those who are unfamiliar with proper exercise technique, aren't the only ones that appear to be at risk. In fact, one article in the Journal of Human and Sport Exercise compared the effects of increasing loads on technical form during the squat and deadlift among athletes from novice to experienced levels. The study found that the highest reading of relative and total inclusions, or deviations, during the deadlift was from the strongest and most experienced lifter, which makes the point that deviations in form are more dependent on the loading percentage of your 1 rep max, rather than individual technique. While familiarity with an exercise, training age, and relative loading all play a role in exercise technique, I'd be remiss to mention that fatigue also factors in. 2 articles looked at the effects of fatigue on joint biomechanics during both a bodyweight and a barbell back squat. Both articles not only demonstrated that deviations in form were directly correlated with increasing fatigue, but also total range of motion at both the hip and knee joints were abbreviated, which leads to its own cascade of issues. And as this article by Baroni et al. Demonstrated with the elbow flexors, partial range of motion does not lead to greater levels of muscular damage compared to full range of motion, regardless of loading percentage used. Which means that although heavier loads were used during the partial range of motion group, using lighter loads but going through full range of motion produces greater muscular gains. I would like to point out though that in both of the previous studies, they used a pyramid set training protocol, in which subjects used 75% of their 1 rep max across sets. They started with one set of 10 reps and reduced the number of repetitions consecutively by 1 until they reached a set of a single rep. The subjects were also instructed to perform the prescribed repetitions as fast as possible, which is contradictory to general strength and hypertrophy rest period guidelines. Nonetheless, when training close to fatigue, even with proper rest periods, small deviations in form are expected. Interestingly enough, the authors found that deviations in form began as early as 70% of the subject's 1 rep max, with both total and relative deviations rising exponentially as the subjects reached 90% of their max effort. In conclusion, I think the best way that you could apply this information practically to your lifting routine, regardless of experience level, would be this. Before maxing out on an exercise and trying to move up in weight, become comfortable with proper technique first. Once you feel comfortable, try to maintain as best form as possible throughout your working sets. Keeping in mind that at loads above 70% of your 1 rep max, small deviations in form are not only normal, but inevitable. If your main goal is to lift as much weight as possible, then lifting at or above loads of 90% of your 1 rep max will place you at the greatest risk of injuring yourself, due to the large amount of technical errors seen with maximal loading. However, this is a consideration that needs to be made by you as to whether or not the goal of gaining increased size and strength is an acceptable trade-off for potential injury risk. Well, that's it everyone. I hope you enjoyed the video and can apply these principles of exercise technique to your own lifting routine. And as always, please subscribe to the channel and leave a comment below on anything else you want to learn about.